I'm Mabel Jong. Thanks for joining us. I'm sitting here now with Bob Franceschini with McKesson Health Solutions, and we're going to talk a little bit about cloud computing. And Bob, first of all, cloud computing, can you define that for us?
Sure. So there's, if you've been following this concept for some time now, there's been a lot of hype about cloud computing. And I think it's evolved a bit over time. A number of different areas where people will define cloud computing, everything from infrastructure to software solutions and so forth. And that's all great because it's important to be able to have an infrastructure that's economical, where you can pay as you go, and an infrastructure that is adaptable to your needs, so it can scale up and down depending upon what you're looking to actually do. But what I'd like to talk about more so is the applicability of that to healthcare. So when you think about that infrastructure, that environment, which is very important, that economical environment, it's also important to think about how you would apply that technology. And what I've heard coined once before, and I really like the concept, is this concept of a healthcare ecosystem, where you've got a community combined with an environment to actually deliver a system or a solution. So the community in this case is really the stakeholders of care, payers, the providers, the members, and so forth. The environment is the infrastructure that I mentioned earlier, the computers, the networking, and so forth. And then when you combine them, there's a symbiotic relationship there. So the stakeholders of care, the community, now has the ability to do things that has been very challenging for them in the past, such as to collaborate, to interoperate, to communicate, to make information accessible and available, and all in a consistent and meaningful way. So if you think about your healthcare and the fact that you have a doctor and you have information that you need to make the right decisions, oftentimes that information, the cost of care, the things that you're eligible to actually have done, and that information is oftentimes disjoint. It's not often consistent. So your provider may not have the information that's current and
applicable to you.
Exactly. You may not have all of your choices and options available to you. And you may not know about things like the cost, which is where the payer comes into the equation. By having an infrastructure that brings all of that information together in a consistent way, makes that information available to all the stakeholders of care when they need it, you can then do some very interesting things like coordinate care. So as we get into the concepts such as ACO, accountable care organizations, payer-centered medical home, provider-centered medical home, and so forth, it allows us to actually do things that we haven't been able to do in the past, which is to be able to coordinate care, provide more advanced decision management support, to do advanced analytics, because all of the information is there and the people that care about that information are connected to the information.
How effective can it be currently, since there's a lot of uncertainty in the healthcare space now, and even health exchanges that are in existence in other states and up and running, they're afraid that once we have a more clear picture of what's legal to do, they may have to change their infrastructure. So this cloud computing that you're referring to, is it in concept a good idea, but you can't put it completely into play until you know all the rules?
Well, I think it's fair to say that. How far and how broad you go with this will vary depending upon those rules. But I think there's some very significant steps that we can take today with cloud computing. There are organizations that have all of the pieces and parts. When I talked about that environment before, it's not just about the computers, but it's about the solutions that I need as a stakeholder to actually do what I need to do. So it's tools for research, which I use as a patient, but it's also the tools that my provider and my payer need to be able to understand the financial cost and also the appropriate care that I'm eligible to actually receive. So those pieces and parts are there today. And when we talk about cloud, there are ways to establish clouds or that infrastructure, that environment that I mentioned, in a way that does align with the current legislative and HIPAA in particular requirements and so forth. So there are ways and things we can do today to also be able to preserve the privacy of that information, but also to be able to provide these kinds of solutions today without having to wait for the legislation to be finalized and so forth.
Okay, well, certainly a topic that needs to be explored further. I'm sure we can go to your website to learn more.
Absolutely.
All right, and McKesson Health Solutions. Thanks for watching. I'm Mabel Jong.